bone tumors and their radiological findings, or you can say the radiological features. This is very, very important. So first we are looking at the sun ray appearance of the Codman's triangle. This will be our first. So you have the sun ray. So there is sun ray appearance of the Codman triangle. Sun ray appearance of the Codman triangle. So the question is, first question is, where does this appear, in what tumor? And the second question we want to ask is, where is the popcorn? The popcorn or the punctate or the coma shaped calcification. So we talked about the popcorn, punctate and the coma shaped calcification. So where does this occur? So in case of what tumor does this occur? So now we will be looking at the answers to these questions and learn in detail about major tumors. So first we are going to study about the sun ray. The sun ray appearance or the Codman's triangle. So what kind of tumor does this include? So this includes the osteosarcoma. So it includes the osteosarcoma, but it can be seen in any malignant lesion. So it can be seen in any malignant lesion as well. So the sun ray is osteosarcoma. Then we look at the onion peel appearance. The onion peel appearance. So where does the onion peel appearance take place? The onion peel appearance is nothing but the Ewing sarcoma. The onion peel appearance is the Ewing sarcoma, but can be seen in case of the malignant lesions or the chronic osteomyelitis. So it is seen in case of the malignant lesion as well and the chronic osteomyelitis. Next we look at the soap bubble appearance. So where does the soap bubble appearance take place? The soap bubble appearance, it takes place in terms of the giant cell tumors and the adamantinoma. Also the adamantinoma. And then we move on to the looking at the ground glass appearance. So the next we look at the ground glass. So everything is very important. So in case of the ground glass appearance, or it is also known as shepherd's crook deformity. So ground glass appearance or the shepherd crook's deformity. So this basically means that there is a fibrous dysplasia, indicating fibrous dysplasia. Next we move on to the patchy calcification. So what does this patchy calcification indicate? It is nothing but a chondrogenic tumors. So it is nothing but the chondrogenic tumors. So the chondrogenic tumors is nothing but it includes the chondrosarcoma. It includes the chondrosarcoma as well as the chondroblastoma. So this is all the patchy calcification. Then we move on to the popcorn. So we might have asked this question. So popcorn, punctate or the coma shaped or the coma shape calcification. So the popcorn, punctate or the coma shape calcification. This is seen in case of the chondrosarcoma. Next, we'll move on to the, so in short, it can be called as CS, the chondrosarcoma. So next we are going to look at the stippled or the punctate calcification. So what do you mean by the stippled or the punctate? Stippled or the punctate calcification. So what is meant by this? So stippled and the punctate calcification is nothing but the chondroblastoma. And then we also have the homogeneous calcification. So what is this homogeneous calcification? It includes the osteogenic tumors. So the osteogenic tumors. So that is the osteosarcoma. Next, we are looking at the fallen fragment, the fallen fragment of the trapdoor sign. Trapdoor sign or the fallen fragment. So here, this involves a simple bone cyst. So this is nothing but the simple bone cyst. Next, we are looking at the double density fluid levels. So where does the double density fluid levels, and so there are conditions. So the double density fluid levels and the intralesional septation So where is this present? So this is present nothing but the aneurysmal bone cyst. So it's present in the aneurysmal bone cyst. Next, we look at the winking owl sign. So just to recap, the double density. When we hear the word double density, it is nothing but AB, that is the aneurysmal bone cyst. Now, when we look at the winking owl, So what does the winking owl refer to? The winking owl refers to the vertebral. It refers to the vertebral metastasis. Then we'll move on to the polka dot sign. The polka dot sign. The polka dot sign or the corduroy or the jailhouse sign. So all this, the polka dot sign, the corduroy and the jailhouse. So all this, it refers to the vertebral. It refers to the vertebral hemangioma. So the polka dot sign, the corduroy and the jailhouse sign refers to the vertebral hemangioma. Then we move on to the moth-eaten bone. So where is the moth-eaten bone present? So moth-eaten bone. So the moth-eaten bone, it is present in the case of the that is a multiple myeloma. Okay, so now we'll be answering our questions. As we know that we have asked two questions. The first question being, where is the sun ray appearance as well as a Codman's triangle? So where is this present? So this is present in nothing but the osteosarcoma. But it can also be seen in case of the other malignant lesion. Then the second question we asked was in case of the popcorn. In terms of the popcorn or the punctate. The popcorn punctate or the coma-shaped. Popcorn punctate or the coma-shaped calcification. So where does all this occur? So all this occurs in case of the chondrosarcoma.